watching Rogers TV.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I am absolutely delighted to welcome two guests. First of all, in no particular order, just on the way that it's been presented to me, Lisa Alguire, who is the public health nurse at Grey Bruce Public Health, and Angela Yenssen, who is a staff lawyer, Grey Bruce Community Legal Clinic. I want to welcome both of you, and our topic today is one that's really, really important and interesting for sure for me, the Grey Bruce Elder Abuse Network. So welcome.
Thank you.
Thank you for having us, Carol.
My pleasure. My pleasure. So you've sent me some wonderful questions, and I'm just going to encourage you to toss it back and forth. We were joking about me getting a croaky voice, so don't worry if I'm sort of around, but just not quite in the conversation. So, elder abuse. The first question you sent me was, what is elder abuse? And I'm wondering who'd like to take that.
Sure, I can start us off, Carol. I guess the first thing I'd like to say or mention is that older adults are valuable members in our society, and they play really important roles in our community. Older adults are volunteers, they are caregivers, they're employees, they're employers. So they play those really important roles in our community. But we do know aging is a natural part of the life cycle. And elder abuse is a serious issue that has come up. And the number of people who experience elder abuse is predicted to increase.
Yeah.
So the World Health Organization defines elder abuse as a single or repeated act or lack of appropriate action occurring within any relationship in which there is that expectation of trust that causes harm or distress to an older person. So there are several types of abuse that can cause harm or distress to an older person. So just to mention, some of those types of abuse might include physical, psychological or emotional, financial, sexual, neglect, and abandonment. And those multiple forms of abuse can happen at the same time, and they can occur in several settings. They can occur in institutions like long-term care homes. It can occur in our community settings or even in our private homes.
Right.
So yes, it is a serious issue that is currently being addressed.
So I do have some questions on top of your questions. You knew that I would, right?
Yeah, of course, and that's okay.
When you say the word elder, is there a magic age frame that you're referencing to when you talk about elder abuse?
Yeah, that's a good question. And we did at Public Health just do a full kind of review of the literature so that we could get a sense of kind of what the terminology is and kind of those age groups. So for the purposes of our content today and for the review of the literature, we're considering an elderly person or an older adult or a senior, because there is a lot of language with this topic as well. Anyone over the age of 65 is what we're classifying an older adult as.
There are programs that are available for people at younger ages that support seniors. Some agencies have a cutoff of age 60. Some even go as low as age 55. What tends to be the most important factor in assessing if someone is at risk of elder abuse is if they have problems associated with older age. So, for example, someone who is afflicted with an illness such as dementia, that's more common at older ages. That can sometimes happen when people are in their late 50s. And so then we try to, in health and social services, ensure that the services for older adults are accessible to those people who have issues related to older age. And we would want to capture those people when we're looking at senior abuse.
Public health. Why is public health involved, Lisa, in this? And thank you, Angela. And it's great. You're back and forth. So this is super.
Yeah, so I can tell you a little bit about why this is a public health issue, and maybe talk a little bit about, what is the current situation of elder abuse in Grey Bruce, or even provincially and globally. So the abuse of older adults continues to be a low priority globally, despite the extent and the severity of the issue. I think due to limited data collection and likely underreporting of cases, the magnitude of abuse of older adults in Ontario is not fully known. But Elder Abuse Prevention Ontario suggests that between 8 to 10% of older adults experience some form of abuse. Aging populations are rising in many countries, and the number of people, as I mentioned earlier, who are experiencing abuse is predicted to increase. So if we look at our numbers here in Grey Bruce, 1 in 4 of our population is aged 65 years and older, and they make up the fastest growing segment of our population. So between 2016 and 2021 census data, there was a 19% increase in older adults 65 years and older. The next fastest growing population is older adults 85 years and older, with a 9% increase. So when we look at this data, we know public health plays a really important role in protecting the public and working with our healthcare and our non-traditional partners in responding to community issues such as this. Efforts to prevent the occurrence of elder abuse and to reduce the impact for people who are experiencing abuse must be considered in our practice in the work that we do. And at the same time, a community-based approach is required that would include governments, policymakers, healthcare systems, our social services, and the public, as we are all being challenged with meeting the complex needs of an aging population. So I think the data speaks for itself, but also, public health does play a really important role in addressing community issues such as elder abuse.
I had the opportunity this week to read some literature about some research that's been done looking at an association between elder abuse and increased mortality rates. And there is some research to support the proposition that elder abuse does hasten death. In particular, neglect is a form of abuse that research has found results in older adults dying sooner than they would have if they wouldn't have experienced the abuse. So it's research that supports very much what Lisa is saying, that this is a public health concern. My understanding is that the mandate of public health is to be concerned about the health of the population. And so elder abuse is something that threatens the health of the population of older adults. So it's been wonderful to have this support from public health for the work of Grey Bruce elder abuse prevention.
And that's a beautiful segue into the next list of questions, which is about, so what are we doing here in Grey Bruce about prevention and addressing the concerns? But one of the phrases I haven't heard you say, but as you're discussing elder abuse, the word victim comes to my mind, that elder abuse is a form of victimization of those in certain age groups. Do I have that right?
It is that elder abuse is fundamentally about taking advantage of someone and harming someone in some way. So, for example, we think of people being victims of physical violence. That can happen with elder abuse. Also, victims of sexual violence, victims of financial abuse. So, people can lose their money through abuse. And so it is reasonable to use the term victim to describe the phenomenon of someone experiencing elder abuse. There's certainly a proposition among people who work in violence prevention generally that we prefer to talk about people who have experienced abuse as survivors rather than victims, recognizing their strength and resilience. But yes, if you prefer the terminology of victim, it would fit with elder abuse as it does with other types of abuse.
So there is a network as a strategy, actually. Tell me more about the network, who's involved and how it can help.
Yes, the Grey Bruce Elder Abuse Prevention Network is a small group of people who are trying to move forward awareness and increase services related to elder abuse. So I currently chair the network. Lisa is a member of our network representing public health. Then we also have representatives from the Southeast Grey Community Health Center, Beaver Valley Outreach, which is an organization that operates out of Thornbury. And then we have in the past had connections and representatives from Theatre as well, the social theater company, and we are strengthening our partnership with Theatre as well through our work. And then we have representatives as well from Saugeen First Nations through their health services team. So we just represent a small segment of the organizations and professionals who work with older adults. And we're very concerned about bringing this issue forward in our community. We've been successful in obtaining some grants in order to help us to raise awareness about this issue. So one of the grants is to provide education. So we've been focused on educating older adults about tips to avoid fraud and scams, and also tips to avoid home takeover. Those are two types of elder abuse that I can tell you anecdotally seem to be on the rise in our communities. And so we've targeted education around those issues. We also have another grant to complete an environmental scan. So we are interviewing older adults in our communities. We're also serving service providers to older adults, trying to understand what services do we currently have to address elder abuse, and how do people in the community currently understand this issue. As we're pulling the data together that we've gathered, we are going to propose a coordinated pathway. Right now, our services in Grey Bruce are rather disorganized around elder abuse. No one's really quite sure where to go, how to address the issue. So out of this environmental scan information, we plan to develop a proposed coordinated pathway so that people will know the steps to follow if they have concerns about an older adult.
I wondered if you could, this is wonderful because as Lisa mentioned earlier, the statistics we anticipate could rise based just on the aging population and in Grey Bruce particularly. The network, how does that, or does it align with the community safety and well-being plan? Because this is a well-being issue for our older adults.
It is a well-being issue without question for seniors in our community. Right now, my understanding is that the Community Safety and Wellbeing Plan is focused on following up the priorities that community members identified when surveys were done to ask our community members, so people living in Grey Bruce, what were of greatest concern to them around issues related to well-being and safety. And elder abuse did not actually make that list. So Lisa and I appearing on your program today is part of the efforts of the Elder Abuse Prevention Network to change that. Yeah. That given our high older adult population in Grey Bruce, this should be an issue on the radar in our communities. And so we're very much trying to help people to understand the issue so that in future surveys, elder abuse is something that's identified as a priority. We will hopefully still be doing some work on this issue through the Community Safety and Wellbeing Plan through the gender-based violence priority area for that plan, simply because older women are more at risk of abuse than younger women. So when we look at gender-based violence, there is a trend that older women are disproportionately affected by that issue compared to younger women. So through that issue, we will hopefully be doing some work on elder abuse prevention through the Community Safety and Wellbeing Plan.
What resources, I mean, you mentioned the grants, but what other resources do you have? Or if people want to learn more about this, because, for example, what you've just shared about the difference between older women and their risk factors and younger women is really important to know. Where can people go, or who can they call to learn more about this?
Lisa has actually been doing some work at Public Health to make some information easily accessible to people. So Lisa, I'm going to have you talk about that first, and then I'll add in a few other ideas.
Sure. So as I mentioned, part of our role at Public Health when we came on board to join the Elder Abuse Prevention Network was working on looking at a literature review. You know, what does the literature say, and what are some of the evidence-based practices to support action towards reducing the incidence of elder abuse and reducing the impacts for those who are experiencing elder abuse. So we have just kind of finalized our document. It's quite a lengthy document because it's a review of the literature, but it's also a situational assessment. So we really wanted to look at, you know, some of the population health data and get a good picture of what was happening here in Grey Bruce. So as a result of that document that is now being finalized, we will have an infographic that we can now get out and share, and it'll talk a little bit, it'll summarize the literature and talk a little bit about what elder abuse is, why it's an issue, why we need to work together collaboratively to address the issue, what are the risk factors, what are the impacts for older adults, you know, and not just at the individual level, but why should we care as a society, as a community, as it is impacting, you know, us at different levels. So that is coming. It will be available on our public health website in the very near future. But the goal is really to get out and to share this information, to talk about the content and the work of the network, to build relationships and partners in our community. And I've already kind of experienced, you know, with being part of the network and getting out and talking about the issue itself, is that people are interested and wanting to know what they can do and how they can be involved. So I'm really excited about the network and how it may evolve with partnerships and the work that we're doing. The community partner survey that's part of the project plan, I think, will help to build capacity within the community. So I'll throw it back to you, Angela, to maybe talk about Elder Abuse Prevention. Ontario has some great resources as well.
Yes, certainly the Elder Abuse Prevention Ontario website has a wealth of resources around understanding elder abuse and some possible responses to abuse and strategies to prevent abuse. Locally, one resource we also have available is that the Grey Bruce Community Legal Clinic has received funding from the Law Foundation of Ontario to complete an elder law project. So elder law is a term that is used in reference to legal issues that disproportionately impact older adults. So for example, the rights of people living in congregate settings such as long-term care home and retirement homes. Those facilities are available to adults of all ages, but it tends to be older adults who live there more so than younger people. So for that reason, we consider rights in long-term care homes and retirement homes to be elder law issues. So as I was saying, the Grey Bruce Community Legal Clinic has received funding from the Law Foundation of Ontario to provide education to the community about elder law issues. So I'm privileged to be the lawyer who is working on that project. And through that project, I'm able to be in the community and provide information about the legal dimensions of elder abuse. And I'm very specific to say that I'm talking about the legal dimensions of the issue because the legal aspect is just one part of the issue. There are many dimensions to elder abuse, which is why it's so complicated to address and why the issue tends to land not with any specific agency to follow up because it is so complex. So for example, when I'm talking with people about the phenomenon of home takeover, so for example, adult children moving into the older adult's home, basically pushing the older adult out of the home or relegating them to small spaces within the home, I say that there's really not a legal solution to that situation because the older adult is the owner of the home. They have the right to kick the adult child out at any point in time, but they don't want to do that because they don't want to damage their relationships with their adult children. And so the solution to that sort of elder abuse is more in the social realm. How do we work through this relationship to address the problems in the relationship versus any sort of legal action? However, there are some aspects of elder abuse with which the law can be a useful tool. So for example, if someone is appointed as a legally authorized substitute decision maker for an older adult and they're not properly fulfilling the roles of legal substitute decision makers, there are tools we have to remove those people and take away their authority and protect the older adult through the legal system. So that's the sort of information I'm sharing with the community through this elder law project. What are some of the legal tools to protect yourself from abuse and to respond to abuse if it is happening to you or someone you know, and also to identify when it's more of a social issue rather than a legal issue, and to talk about some of the resources available if it is a social issue. So as you hear, if it's a legal issue, you have the Community Legal Clinic of Grey Bruce as a resource to problem solve that situation. And if it is a social issue, certainly calling 211 is a good default. If people don't know where else to go, call 211 and they can direct people to some resources to help with the social aspects of the situation. Home and Community Care Support Services Southwest is another possible resource in terms of arranging care coordinators or social workers to help problem solve a situation. With elder abuse, we do want to emphasize that there is no wrong door and every door is the right door. So if people are concerned about someone, just talk to anyone who crosses your path, be it your family doctor, your neighbor, other people you know, for example, in your church community, and together figure out where you can go to get assistance because you never know what sort of connections people might have who are in your life that can give you support.
The term elder law is new to me, so I'm really glad that you mentioned that because that's really important for individuals to know that there is a focus on the rights of those who are in a certain age groups. Just rewinding just briefly in the few minutes we've got left, I really liked when we chatted about victim that you flipped it to survivor, that you were talking about survivor, which is absolutely what we want to emphasize. One of the things I've learned is the value of having those with lived experiences, supporting others with lived experiences, because they have that information, that lived experience. As you move forward and do your research, will this be something you will be looking at, or the possibility of support networks for those who've experienced this type of abuse?
As one of the deliverables in our project grants is to set up a volunteer speakers bureau so that there will continue to be information going out into the community about elder abuse prevention once our funding is finished. And through that speakers bureau, we will develop some protocols so that if someone does disclose elder abuse at an information session, they have a clear path that they can follow to know where they can go. And hopefully, as we receive more disclosures from people, there's the option to develop some sort of a support system for peers who have been through this experience. Right now, it is really difficult to build that sort of support system because no one wants to talk about it. And it's so often because abuse happens in families, or people are ashamed of having been abused by their family, or they don't want to get their family member in trouble. So often people don't want to talk about these issues. And we're very much hoping the work that we're doing will open up conversation, because it would be wonderful to have someone involved in our network for elder abuse prevention who has lived experience, but we have not had any success with finding anyone who discloses that they've had that experience and wants to inform our work. So hopefully, as we continue to get the word out, people will feel comfortable to disclose what's happened, and then we can get people connected who share that experience, and they can inform policy and program development to respond to the issue.
So absolutely, we need people to come forward, speak up, and it's not just the person who's experiencing the elder abuse, but all of our community together has a responsibility towards protecting those. As you started out the interview, Lisa, we value our elders, right?
Absolutely.
And we support them. We have less than a minute to go. Who wants the closing comments before I wind down?
Well, I have, sorry, Angela, you go ahead.
Well, I just wanted to thank you, Carol, for having us on your program, because the key to moving this issue forward is breaking the silence. So thank you for contributing to breaking the silence on this issue.
My pleasure. I will also look forward to receiving, you have my email, the infographic, and all of the information, because I'd love to have you both again. And anyone else you would wish to invite, because this is an absolutely critical, it's an incredible social issue that impacts those we value in our community. So I will absolutely want you back again, but any information you can share in advance to me, because you never know who I could connect with to share the word, right? You just never know. Yeah, I want to thank you both so much for being on the program today. I've certainly learned a lot, and this is an issue that we have to bring front and center in Grey Roost, but also globally. It's a global issue. Thank you for your time, and I want to thank the viewing audience for joining us today as well to learn more about programs, services, and resources available to you and to your families. Take care and stay.
Connect with us by visiting our website or email us at comments@rogerstv.com.
Today, I helped a parent feed their family by connecting them to a food program.
Today, I helped someone connect with mental health supports.
Today, I helped a couple struggling